This patient education video is one in a series brought to you by the American Academy of Allergy, Asthma, and Immunology. And sponsored through an unrestricted educational grant from UCB Pharma.
For most people with allergies, symptoms such as sneezing and runny noses are caused by relatively common allergens. Outside of the home, pollen and mold are common triggers for allergy symptoms, and inside the home, animal dander and dust mites are frequently culprits. But for about 2% of the adult population and 8% of infants and children, certain foods cause allergy symptoms. An allergic reaction occurs when an allergic person is exposed to a substance that is otherwise harmless. The substance or allergen causes that person to produce allergic antibodies called IgE in response to the allergen. These antibodies attach to mast cells which contain histamine and other powerful chemicals. When the allergen again enters the body, it attaches to the IgE on the mast cell, causing the release of histamine and other chemicals into the body. These chemicals affect various parts of the body and can cause symptoms such as nasal congestion, sneezing, rash, labored breathing, or other reactions. A true food allergy is one that involves IgE. That is, proteins from the foods to which you are allergic enter the bloodstream and cause the immune system to react, as described. However, some symptoms that seem to be caused by food allergies are actually due to food intolerance. Food intolerance symptoms are usually caused by diet, but unlike true food allergies, don't cause the immune system to react. One common source of food intolerance is milk sugar or lactose. Some people lack the enzymes necessary to break down milk sugar for proper digestion. For these lactose-intolerant people, milk sugar will generally cause stomach cramps, stomach upset, and diarrhea. Other food intolerance symptoms may be caused by drug-like chemicals in food. Caffeine in coffee, tea, and soft drinks can cause nervousness and sweating in some people. Chemicals found in chocolate and cheese can cause headaches in people with sensitivities to those chemicals. Although they rarely cause symptoms, other sources of food intolerance are food additives and preservatives. Common food additives include aspartame, benzoates, yellow and red dyes, MSG, and the preservatives nitrates, nitrites, and sulfites. People who are sensitive to food additives or preservatives should be aware of their presence in food. Your allergist can help you identify problematic foods so that you can eliminate them from your diet. Again, a true food allergy is one that provokes a response from your immune system. The most common food allergens, responsible for up to 90% of all allergic reactions, are the proteins from cow's milk, eggs, peanuts, wheat, soy, fish, shellfish, and tree nuts. For some food groups, particularly seafood and tree nuts, such as walnuts and hazelnuts, an allergy to one member of the food family may result in a person being allergic to other foods of the same group. So if you're allergic to walnuts, you're more likely to be allergic to other tree nuts as well. This is called cross-reactivity. It is possible to be allergic to both peanuts and walnuts, although they are from completely different food families. This is called coincidental allergies. Within the group of animal food proteins, cross-reactivity is not as common. For example, most people allergic to eggs usually can eat chicken, and a person allergic to cow's milk can eat beef. Cooking some foods, such as fruits and vegetables, can reduce their ability to cause a reaction. But in general, most foods will cause a reaction even after being cooked or digested. Reactions to food can affect the skin, the respiratory system, and the gastrointestinal tract. The most common skin reaction is hives. Hives are red, itchy, swollen areas of the skin. They occur suddenly and can disappear as quickly. They tend to appear in clusters, with new clusters forming as other areas clear. Atopic dermatitis, or eczema, is characterized by itchy, scaly, red areas of the skin. While this condition is generally chronic in people with allergies and asthma, eating certain foods can cause eczema to flare up or worsen in people with food allergies. Gastrointestinal symptoms of food allergies include vomiting, diarrhea, abdominal cramping, pain, abdominal swelling, and gas. There can also be swelling of the mouth and throat and a red rash around the mouth. Certain foods may trigger asthma symptoms in asthmatics, especially in infants and children. It is not uncommon for infants to have non-allergic temporary reactions to certain foods, such as fruits, cow's milk, egg whites, peanuts, and wheat. Symptoms include a rash around the mouth and diarrhea. Although some of these symptoms may be allergic reactions, many are due to the infant's immature immune system. If a baby has a reaction, avoid feeding the suspected food to the infant for a few months to see if the symptoms subside. Some children, as they grow older, may tolerate foods that previously caused allergic reactions, with the exception of an allergy to peanuts, tree nuts, fish, and shellfish. These allergies often remain into adulthood. It's important to see an allergist immediately if you suspect foods are causing a reaction in your child. The allergist can help determine if the reaction is an allergy or an intolerance. In severe cases, food allergies can cause a life-threatening reaction called anaphylaxis. Anaphylaxis is a systemic or whole-body allergic reaction that can be fatal. Symptoms can start with a feeling of warmth, flushing, tingling in the mouth, or a red itchy rash or hives. Further symptoms can include a feeling of lightheadedness, shortness of breath, sneezing, anxiety, stomach cramps, vomiting, and diarrhea. If severe enough, people may experience a drop in blood pressure that results in a loss of consciousness. Without immediate treatment, anaphylaxis can cause death. Your allergist is the most qualified medical professional to diagnose food allergies. The physician will first take a thorough medical history. Of particular interest is the presence of allergies in other members of the family. Next, your allergist will perform a physical exam to identify signs of allergic disease. Of course, the allergist will want to discuss the nature, frequency, and severity of your symptoms. If you are a parent of a child with suspected food allergies, provide as much information as you can about your child's diet and symptoms. Your allergist may have you keep a food diary in which you record which foods have been eaten, when they were eaten, and any symptoms that occurred. If a particular food is suspected, your allergist may recommend removing it from your diet for a while to see if symptoms improve. If they do, the food may be added to the diet again to see if symptoms reoccur. Of course, this is not done if the food causes a serious systemic reaction. Finally, if the diagnosis of a food allergy remains in doubt, a food challenge test may be performed. This test can be done in the physician's office or in a hospital under close observation. The suspected food is given in very small amounts to the patient over a period of time. If there are any resulting symptoms, they are noted and recorded. This test is very reliable for determining if a food allergy exists. Again, because food allergies can be serious, your doctor will closely monitor this test. There are several ways to perform a food challenge test. Your allergist will select the test that's best suited for you. As mentioned earlier, some children will outgrow certain food allergies, but there is no cure for adult food allergies. With that in mind, there are 4 things that you can do to control food allergies. First, avoid the food. Completely eliminating it from your diet is the first and most effective thing you can do. Second, ask about ingredients and make sure to inform the restaurant servers or others that you have food allergies. When eating away from home, it's important to ask about the ingredients in each dish, as well as how each dish was prepared. For example, a dish may not actually include peanuts, but it may have been cooked in a pan that was used to cook a peanut-containing dish. Many places will be able to make ingredient substitutions for you or alter the method in which the meal is cooked. Third, read food labels. To do this effectively, you may need to learn the technical or scientific names for certain foods. For instance, milk may not be listed as an ingredient, but a label may list casein, a milk protein. Gluten may be listed instead of wheat, and albumin instead of egg whites. Your physician can help determine which ingredient names you should look out for. Finally, be prepared for emergencies. Anaphylactic reactions due to food allergies can be life-threatening. If you have severe food allergies, you may need to carry and know how to use an injectable form of epinephrine. You may also want to wear a special bracelet describing your allergies. If you've accidentally ingested a food you're allergic to and develop anaphylactic symptoms, use your injectable medication right away and immediately call 911 or have someone take you to the nearest emergency room. You should always receive emergency care. Your injectable epinephrine is only a Band-Aid. It buys you time to get to the emergency room. After that, you should follow up with your allergist for appropriate long-term management. Parents should inform all school personnel about their child's food allergies. Identification sheets with the child's name, photograph, specific allergy, warning signs of reactions, and what to do in case of an emergency are all important pieces of information for the staff to have on hand. If the child carries an injectable form of epinephrine, it should be clearly marked and must be placed where all school personnel can find it. Children who are old enough to self-administer epinephrine should be allowed to carry it with them. If they need to use it, this should be done with adult supervision. Parents should never sign a waiver absolving the school of responsibility to administer epinephrine in case of a reaction. It's also useful for the child to wear a special necklace or bracelet describing the allergy. If your child eats in the school cafeteria, then make sure to inform the cafeteria staff about the foods your child needs to avoid and safe substitutions. By law, food service staffs are required to prepare special meals of equivalent quality if your child cannot eat a regular meal. The food service staff must know technical and scientific names for certain foods. They also must avoid cross-contamination of foods during preparation and serving of the food. It's important to remember that once a food allergy is diagnosed, allergic reactions are usually preventable. Guidelines for the child should include 1. No trading or sharing of foods, utensils, and containers. 2. Washing hands before and after every meal. We all enjoy food. People with food allergies must work closely with their allergist. Educate themselves and know how to buy, prepare, and order food. With the right ingredients, even people with food allergies can experience the spice of life and enjoy rich culinary experiences.
For more information, please call the American Academy of Allergy, Asthma, and Immunology at 1-800-822-2762 or visit our website at www.aaai.org.